I think it's what discussing loneliness as what it is. It's a feeling, right? It's that subjective feeling of being disconnected from people. You could be in a room full of people and still feel lonely. You could be by yourself and not feel lonely.
This episode of Bring Back the Porch brought to you by Bernie Leahy, River Street Realty. Let's get you home.
The information provided today should not be taken as medical advice. So I'm very excited to be able to welcome our guest today. Dr. Aganren has been in Medicine Hat for about a year. He and his lovely family moved here from the UK. He works full-time for Recovery Alberta and also has his own clinic, Claritas Healthcare. He is a much-needed psychiatrist. So welcome very much.
Thank you for having me, Aina.
Yes.
Thank you.
The first thing I would like, I think, is just for you to kind of talk a little bit about your experience moving to Canada, moving to Medicine Hat, and just the work that you're doing. What do you think? How's it going?
It's been lovely so far. So yeah, I moved in December last year. Crazy. I came.
It was cold.
It was cold. It was snowy. It was a day or two to Christmas. But I felt it was the right thing to do. I did enjoy. I loved it, of course, in England. But I just wanted to do something more. I've never been one to stay in a place for too long. So it was a lot of convincing. But
with the family?
The family, they agreed. And then I met you and Bernie.
Yes.
And I knew I made a right choice. Very welcoming.
And the community has embraced you?
The community has embraced me. When I opened my clinic, the mayor was there.
Really?
Yes.
Yes.
It felt like I was part of
the community already.
So yeah, I've really enjoyed relating with people. The work has been excellent, right? Some days are stressful, but overall, it's just a pleasure to serve and help people as much as possible.
Yeah, that's lovely. Great. So today we're going to talk a little bit about the loneliness.
Yeah.
I was reading an article and it talked about loneliness being an epidemic. And so I kind of wondered what your thoughts were about that.
Yeah. So I think it's what discussing loneliness as what it is. It's a feeling, right? It's that subjective feeling of being disconnected from people. You could be in a room full of people and still feel lonely. You could be by yourself and not feel lonely because you have connections and you have deep connections. So yes, loneliness is really difficult. It's a really difficult place to be lonely. Regarding it being an epidemic, I would say so, because it's at the proportions at which a lot of people are lonely, right? We're in a world where we're supposed to be connected. There's social media, we have our phones, we can text people, but a lot of people still feel lonely. It's in my practice almost daily. I see people who loneliness has contributed or worsened some of their mental health difficulties. So yeah, I would say it's reached that proportion, because it's a public health issue, and it can lead to more difficulty. So yes, I would say so.
Yeah. So when we talk about that more difficulties, and we look at mental health, and we look at physical health, I think that loneliness really contributes negatively to both of those factors.
It does. Mentally, like I said, in my practice as a psychiatrist, so I would mostly see mental health patients. Trauma-related symptoms can worsen with, when you're lonely and you're by yourself. It's not unheard of to just go back to those difficult experiences you've had. Depression can worsen. Anxiety. A lot of people can become very anxious when they feel disconnected from people. And, there's a lot of other mental health conditions that can be worsened. Physically as well, physical health, loneliness can make you stressed. And stress would release those stress hormones, which can affect your sleep, affect your immune system, affect your blood pressure, and things can just go wrong physically from there.
Yeah, absolutely. Like there's so many different areas that can be affected by that.
That is true.
Right?
Yeah. Have you noticed any, have you seen a lot of lonely people?
Yeah, it's that disconnect with family, disconnect with community, sometimes work, and I think that I think there's lots of, again, different factors, like, people are struggling with, let's say, career, their jobs, people are getting laid off, you're embarrassed, what do? You stay at home.
Yeah.
I think the expectations of Christmas time.
Oh, Lord, it's a big one, Christmas.
It's huge.
Christmas, I've seen so many people just come in distressed, and they just feel awful because this is a season for family. You see other people with their families. You see people professing to have joy, ho, 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 but
yes,
some people don't feel that way. They feel lonely. They feel alone. This is the worst time to feel that way. So it's really hard. It's hard for lots of people during Christmas.
During Christmas time. Yeah. I think expectations are so high, and when we don't achieve those expectations, and then we look inward and say, well, what's wrong with us? Why aren't we able to do that or have that, or why isn't my family like that? And that self-criticism, again, just leads to isolation. It does.
It's, we're doing something about it. We're talking about it.
We're talking about it.
I think that's a good step in the right direction.
I think you're right. What do you think community in general, what do you think the community in general could do for individuals?
So community is group. I think people. So there's what the community as a group can do, and what individuals in the community could do, right? So for a group, I'm talking about government, organizations. We could have more avenues for people to come together. So programs, parties, maybe, places for people to gather and congregate and connect. If we could do more of that, that would be nice. Spaces for children, spaces for adults, for adolescents, for the older people, right? And also it's not just the space, it's the connection. So if, for example, I saw a patient who I felt was lonely, it would be lovely to go to say, oh yeah, I know this program is happening, or there is a place where people, young people or old people can go and, talk to each other. So that connection is important. So having a place first, and then connecting those resources together.
Yeah.
Another thing that could help, and that's more political, it's the transportation.
Oh, to
right?
get people there.
To get people.
Sure.
So if I had to drive, right, I'm already anxious. Why would I? But if there was a bus, if I just come out of my house and there was a bus that would take me to where I needed to be, and I was sure there was a bus to take me back, of course I would do that. And then the finances as well. If people had money, they will be, if they had resources, let's say, they'll be more able to go to these programs or avenues where people could come together. Sometimes people want to go, but they are not able to because, firstly, the weather might be bad. You don't want to drive in the snow. You can't afford it. So those are the things that as a community we could do.
Yeah. I think it's interesting that so your community may have some of those resources, but it seems like it's only those people in the know who know. So groups that, let's say, Recovery Alberta. So they may offer groups, but unless you're connected to them, you don't really know about them.
Yeah, that word connected.
Yeah, right?
You need to be connected.
You need to be connected to know.
Yes, that is true.
And so when it's not in your wheelhouse,
you don't know.
You don't know. Yeah. So then it's hard to share information.
It is. We need more ways to share those information.
Like I know our public library does an amazing job. They have different kinds of groups. But again, and I know for me and the people that I work with, I talk about the library a lot.
Oh, yeah, you told us.
Yeah. I think we're very fortunate to have the lovely library that we do have. And I think it's such, it's free.
It is free.
It's free to people. And it's such a wonderful gathering place. But you probably would believe how many people when I say, do you go to our library? They're like, no, why would I do that?
I did not know. And I'll just say as a personal aside, my children have found lots of positives. They love going to the public library.
And our library really tries to connect people. It tries to do things for all ages, which I think is absolutely fabulous. But it's one place.
It is one place.
We need so much more.
Sure.
Yeah.
Do you think we're utilizing the library as we should, as a community?
No, I don't think so. No.
So we need to improve that as well.
Yeah. Yeah. So again, talking about it. I know that Ken was on the porch, and he's done a great job with our library. But I think again, more people just need to know about it.
I might just drive there tomorrow.
Yes, I'm going there when we're done. I have to drop my book off. Yes. Do you think that, when we look at different factors that create loneliness, I kind of go back to, were things like this before the pandemic? Were people as lonely before?
I think the pandemic broke us as a society. I would say so. Before then, no one had actually known what it meant to be disconnected. I think there was, in UK we used to say face, space, place or something. So you made sure that you had space. Oh, yeah. So even when you're in the room with someone, there is that physical space. I think that was traumatic for lots of people.
Yeah.
Right. And then the pandemic got better. Those restrictions were lifted. I don't think people fully came back. I think people practically prefer to be in their rooms, in their homes, prefer to work from home. Why would you go in if you could just do everything?
Do it from home.
Yeah.
Yeah.
And that connection, that's going to the office or the hospital for me gave, where you just talk to people, those non-planned conversations,
Yeah.
those hellos and highs.
Yeah.
Very important.
Yeah.
You felt connected to something. Now most people don't, and that doesn't help with loneliness.
Mm-hmm.
I think COVID was a big part of it.
Start of it.
I mean, it was already there.
Yeah.
The older people
Yeah.
that couldn't go out but almost everyone, knew what it felt to be disconnected during COVID, and that was hard.
And I think that it almost made people scared of other people.
Mm. Yes, it did.
And so then when we did come back, like I'm a hugger, and when I like to greet people, I like to hug people, and then people are like, no, like, don't do that. I'm like, oh, okay. Like, I'm still the same person, and you're still the same person, but like
We're different now.
Different. Yeah,
Different
absolutely.
Now. COVID was pandemic was, it's once in a lifetime, I hope.
Hope so too. Yeah, you're right. And then what about social media? We talk lots about social media.
Social media. On paper, you're texting more, you're communicating, you're seeing people, you should feel more connected, right? Mm-hmm. Wrong. It's not. For some reason, I think it's like I said, it's the subjective feeling of being disconnected. So connection requires depth. It requires connection. It requires knowing someone, talking to someone, feeling like they are within your reach. Mm-hmm. So for social media, you could see lots of people, but doesn't quite feel the same.
Yeah.
Right? There's a barrier. You texting someone or sending messages on Facebook, it's not the same as saying hello when the person is in the other room.
Yeah.
Right? So I feel like it actually made things worse, because people feel like they're connected, because I'm just a text away, right? I'm just a phone call away. But no, people don't actually reach out as much as we would have if we're less connected. You'll see, you go on a bus, for example, or the train, and everybody's on your phones. This is lots of people in one space that prior to social media would have had to say something to each other. Talked about the weather, talked about politics, talked about stuff.
Yeah.
But now, because of social media,
you don't have to.
You put your head down.
Yeah.
And if you say hello, then you're looked at like, are you crazy?
Yeah. Yeah. Like, don't bother me.
Don't bother me.
Yeah. So I find that the phone is a great way to avoid having to actually maybe have even eye contact with people.
Because it's hard to connect. It's not easy. It takes effort.
Yeah.
And so if you don't have to do it,
it's easier.
It's easier to just avoid it. You suffer for it in the end, but in that moment, it feels like the easier thing to do, to not connect.
Yeah. Yeah. So what do you think, or how can friends and family help? So they see their loved one who is in the basement, not coming out, doesn't have any friends. What can we say to them? What can friends and family, how can they help, guide, educate?
Yeah. You can talk to them. I think I think social isolation and loneliness needs to be kind of teased apart. Some people love being alone, right?
And it doesn't mean they're lonely.
It doesn't mean they're lonely. They enjoy it.
Right.
So that's one. It's important to know that. And some people would have lots of people in the room and still feel lonely. So it's a subjective feeling. And if someone is quite sad in that being by themselves, then go to them, talk to them, just listen to them, encourage them to share how they feel, and ask for practical ideas. How can I help you? I know you feel disconnected. What can I do to make you know that I'm there? That's how you support. And then, of course, you should be connected.
Mm-hmm.
Then you could suggest places for them to go.
Mm-hmm.
If you're aware in the know, you know there is a program here for seniors, or there's a program here for youth. You know, you take them out. Practical, just be, what's the word? Not diligent, just make an effort,
Okay.
right?
Yeah.
Like, make an effort to connect. Could be physical, could be, emotionally.
Mm-hmm.
Just be there, sit in that uncomfortable silence with them
Space.
sometimes.
Yeah. Yeah.
What do you think? How do you think others can...
Yeah, I think that's absolutely, because again, I think we avoid because we don't like the negative feeling, the heaviness of it. So I think it's about having complete conversations with people.
Sure.
Open, honest, yeah.
And hard.
And hard, yeah, absolutely. What do you think about as to individuals? So when individuals maybe come to you, what's maybe some advice that you give to them?
To help them, I say the same thing. So it's the advice, but directed to them. Connect to other people.
Okay.
Don't feel like they're a burden, because most often than not, that's how you feel.
Yes.
Most times people are willing and open to have conversations, because we're humans. We all want connection, right? So I would tell anyone who comes to me, talk to your friend, talk to your family, reach out, tell them how you feel, and practically do the opposite of what you feel like doing when you're lonely. When you're lonely, you just want to curl up in a ball and just sleep and close your eyes,
Yeah.
Do the opposite. Go outside. Right? Go talk to someone, take a walk, go to a place, go to the library where other people are. And that's what I'll say.
Yeah. Yeah. Okay. Is there any one other thing before we wrap up today that you would like to share?
Yes. I want to say that being lonely you should not feel ashamed being lonely. We all have periods in our lives where we feel lonely. That shame can make you not reach out for help. It's not your fault. It's nothing. It has absolute zero to do with you. It's the situation. It's the feeling. And if you can internalize that, you might be able to take those practical steps to get out of loneliness.
And don't you think that there are, in reaching out, that there are both, friends, like social people that you can talk to, but also professionally. Like I think in Medicine Hat that there are a lot of different agencies. So if you don't know of an agency, someone will know. Someone will be able to help guide you to reach out to someone.
That's a great point. Connecting with professionals, it's also important.
Yeah.
We've, I think, mostly focused on the individual, the community, and rightly so, right? Professionals as well, very helpful resource.
Yeah. Yeah.
So,
well, I want to thank you very much
thank you
for coming to
me.
the porch and sitting here with me today.
Really enjoyed my time. Thank you.
Thank you very much. Take care.
Have a lovely day. Bye.
Thank you.
Bye.